province, one hospital command center is now looking to tap additional personnel as calls continues to surge.
From a mere 150 to 175 calls per day, when during this time of surge, we were already receiving 380 to almost a 400 plus.
We have hotlines, different hotlines. We have landlines and cell phone number, but all of those po kasi ay engaged, very engaged po and congested din po yung lines natin. And then so that some of them po ay hindi na nakakapasok dun sa hotline.
The Health Department reports more than 8,100 new COVID-19 cases. This brings the total caseload to almost 893,000, some 173,000 of which are still active.
Corporate groups have joined mounting calls on China to respect the sovereignty of the Philippines and Southeast Asia by withdrawing the Chinese vessels around the West Philippine Sea. The Foreign Affairs Department continues to file more diplomatic protests meanwhile, but when will the country's highest leadership address the issue? We discuss in this episode of The Chiefs. Welcome to this special edition of The Chiefs. With me online are Lucy Cruz Valdez of News 5 and Ed Lingao of One News. Ed, Lucy, good evening.
Hi, good evening, Robbie.
Good evening. Happy Half Day.
Ed, ano bang balita?
Well, if you're looking at the South China Sea, we just sent 3 more Navy ships to add to the 2 already there dun sa area ng ating EEZ. So, yun. That does, although it is something that people have been waiting for, it does raise other issues as well.
Yes.
Kasi you are sending gray ships or Navy ships to an area na medyo tension-ridden right now.
Remember 2 weeks ago, si Secretary Lorenzana was a bit controversial because he said, ingat tayo because we don't want to militarize the matter. And this was the time when Filipinos were saying that, teka muna, it's China that's sending militia ships. But this time, much clearer. And then kaakibat niyan, Ed, Lucy, DFA is actually over-delivering on its promise to have 1 protest a day. They filed 2 protests today.
Yeah. And of course, si Secretary Locsin, pinagmamayabang pa niya na it's very well-worded, no? Although ayaw niyang, syempre, i-reveal ko na yung contents, but suffice to say that he thinks at least that they've made a very strong position on these protests, no? Let's hope it works. On the other side, I mean, yung Surasa naman, di ba, nag-usap si Putin at saka si Presidente.
30 minutes. 30 minutes.
Tagal din ang usapang yun, ha? Ano kaya yun? Gamaleya lang kaya pinag-usapan doon?
Well, among other things, di ba? Isa sa malaking he's committed to ordering millions of doses, if not tens of millions of doses from Russia. And malaking bagay naman talaga yan, di ba? Because this is really one of the things that we're looking forward to.
And possibly setting up an institute here for virus, for vaccine manufacturing.
At saka today we crossed the 1 million Rubicon for vaccinated people. So medyo maganda yun. That's good news. Kahit pa paano naka-1 million na.
Pero malayo pa kami.
But in fact, and buti binanggit mo yan because that really is where we're going to start. Mamaya po, we will talk about the West Philippine Sea. But for now, we'll start with COVID-19 pa rin. We have with us to talk about the latest, Treatment Czar and Health Undersecretary Leopoldo Vega. Good evening, sir.
Good evening, sir. Good evening, Robin.
Good evening, Yusek Vega.
Good evening, Lucy, and thank you for having me here.
Okay, so sir, let's start with the general update. How are we doing? And we also take note na there was a report na yung kahapon we were saying that Okta had noted a rise, a slight uptick in the fatality rate. Now we understand they're saying umabot pa ng 5 ang fatality rate, although we must take note, a lot of that are senior citizens and so on. you take everything into account.
And they happen only in the last 2 weeks. Yeah.
So you take all of that into account.
Right.
I mean, sir, how are we doing?
Yeah, right. In terms of the number of admissions, especially here in the NCR, we've noticed a steady, still in a steady, tight kind of position in terms of the intensive care units. We have on the average an 86% occupancy or the high risk category dito sa intensive care units, and roughly for the COVID beds allocated in all level 1 to level 3 hospitals, roughly it's about 78% still in the NCR. So we see a number of hospitals right now trying to adjust to the present situation by increasing their number of intensive care units and COVID beds. And we've seen this in bigger hospitals in level 3, and we are also hoping na pwede itong level 2. But the most important thing na ginagawa po namin ngayon is to find a measure wherein most of these mild and asymptomatic cases, which have been admitted in level 1 to level 2 hospitals, but mostly in level 1, level 2 hospitals, and very minor in level 3, would be the mild and asymptomatic cases, and that roughly is about 40 to 42% in our data. So if we can actually move them in certain isolation facilities, then definitely that would decongest the hospitals. And in terms of the fatality rate, we've seen the cumulative fatality rate for NCR. It's still at 1.5%. That's cumulative, and roughly it's about 5,000 deaths over 300 plus positive cases, 383,000 something of positive cases. So I cannot, probably the Octa computation was a snapshot of a certain day, wherein they measured about a 5.6. Yes. But the thing is, it's not, sometimes the reports for that day means that yung iba reported these deaths were actually it happened 2 weeks ago or 1 month ago. So there was a case in terms of late reporting, kaya nag-pile up on a certain day. But it doesn't mean that everybody died on that day. So if you take that into consideration, then and the cumulative rate that we have, it's still 1.5, still below the 2.0 mark of the global standard.
Okay.
Usec, I understand po kasi yung the process of freeing up more bed spaces for COVID victims is of course contingent on a very, very good triage system, and I think that's the direction that that your group has been trying to head. Actually last year pa pero more so in the last 2 weeks na napupuno yung ating mga hospital. Let me ask you about that po. How is the triage system working? Is it working? Kasi we still are getting a lot of reports na napupuno pa rin yung mga ICU. Even though sabi nga ninyo 86% lang yung occupancy ng ICU beds, but you still have a lot of complaints and reports na hindi makapasok yung mga pasyente.
Actually, yung pag sinabi mong ICU na 86%, ang highly critical and sometimes ano na sila, within the zone of almost 95 to 100%. You know, yung mga level 3. Level 3 hospitals talaga, matataas talaga ang ICU rates talaga yan. Pero when you go down to the level 2 and some of the government-retained hospitals that we have, nasa mga 86% yan. So roughly in that category. But you were saying sa triage kasi dito triage kasi is a principle of emergency medicine. It's really classification of patients kung sino ma-prioritize. So definitely when you go to an emergency room, if you're less serious, then definitely you will be you will stay behind in terms of prioritization. Yung mga serious cases ang inuuna. So that's basically the concept of triaging. And we have talked to the different mayors, Metro Manila mayors, and asked them, since they have the LGU would have the rural health unit, barangay health stations, and even the inventory of mga medical practitioners, the nurses that they have, if they can possibly do a pre-hospital triage. In other words, since they know, alam naman nila kung sino yung mga pasyenteng mga positive cases within their barangay, is it possible for them to come up with a pre-hospital triage so that hindi lahat ng tao pupunta sa emergency room? Kasi you know what happened in yung mga siguro mga between March, third week of March or second week of March, napansin namin talagang puntahan lahat sa emergency room. And you know, the emergency room is a very dynamic kind of section of the hospital. Kasi nandyan yung mga non-COVID na nangangailangan ng medical and surgical emergencies. Nandyan din yung mga suspect, probable, and positive.
It controlled chaos, kumbaga.
Yes, so the only way, sinabi namin sa mga Metro Manila mayors at that time, is if we can come up with a pre-hospital triage, wherein they can actually make sure that itong mga pasyenteng nangangailangan talaga ng moderate and severe cases can be directed to the hospital. And we've also asked them to link up with the One Hospital Command kasi we have to be integrated in terms of op centers. No? So ang LGUs naman natin lahat, we know for a fact that they would have the emergency op centers. They have been there. During disasters, they usually work. So if we can come up really with an integrated kind of a network in collaboration between the LGUs and our One Hospital Command, that would mean a better kind of classification or triaging.
Kaya lang, Usec, yun din po exactly yung tanong ng mga LGUs na nakausap namin eh. I mean, if we can have a One Hospital Command, if we can have the triage at the level of the local government, that will be great. Pero they're the ones who are saying, ang problema namin is we don't know how to implement that. Kasi nga, pagka dumiretso yung tao sa ER, hindi na mapigilan, hindi man lang nalalaman. So what might be a practical system?
The practical system really is empower the barangay health workers talaga sa baba. It has to be in a barangay level wherein they would know. The barangay would know kung sino may sakit at sino naging positive because they would have a notification. May mga notification sila within the LGU and the barangay levels who are positive or not. So kung if this rural health physicians that they have or yung mga nurses and midwives nila, alam nila kung sino yung who are suffering
but what
from
what does that look like either coming in or going out of the barangay? Does that translate, for example, to a checkpoint at every exit point of the barangay? What does that look like?
Yeah, alam mo, it's kind of complex, because to do this kasi, you have to go against the grain of our cultural way of moving towards hospital as our health direction. Parang ang health-seeking natin, behavior really, kung makita mo, it's really towards the hospital. Kaya it will be very hard for even in the barangay level if to educate
kaya nga rin Usec
to move into that direction. It takes time to do that.
Well, okay, so Usec, let me ask you, how does it work with a one command? Because people usually go straight to the hospital, but when we found out na meron ng one command at nagkakaubusan na, ang tinatawagan nga ay yung one command. Ang tanong ko po, kayo po ba on the one command, sinusunod niyo po ba yung triage system? Kunyari, how do you screen the callers? And how do you parse them out to the different hospitals?
It's like this, Lucy. The reason why we came up with the One Hospital Command is we really wanted to have a good collaboration, coordinated referral system. We set this up last year when we started with the pandemic because nakikita namin na ang daming mga hospitals na bakante at tapos maraming pumupunta sa ER na punong-puno. So we had to make a very good a system or coordinated system or referral to make sure that these patients are given the right institutions, whether they're for isolation or for hospital. Ngayon, pagtawag mo sa One Hospital Command kung madiretso kayo doon sa nagre-receive ng call, there is a doctor there, a medical director who will actually parang on that phone ask you what your symptoms are. So in other words, merong medical direction. So that's the difference. If you get a medical direction coming from the one hospital command, then they will know whether, pwede ka mag-isolation, pwede kang quarantine ka lang, or pwede kang sa hospital, kailangan mo ma-ICU ka, and we will look a place for you. So basically, the one hospital command is a coordinated care wherein the triaging happens because there are medical doctors who provides the medical direction on where to go.
Sir, Mayroong sa pangalan pa lang.
Yun yung pinaka-basic
Aba,
concept.
Yusek, sa pangalan pa lang, malinaw naman. And I think everybody wants to buy into this. But basic question lang po, like you said, last year linaunched to. Gaano kaganda na po yung One Hospital Command ngayon? I mean, in all objectivity, what are its strengths right now? How sophisticated is it right now? And at the same time, what are its remaining weaknesses?
Alam mo, Ed, when we started off this One Hospital Command, it was so hard to, especially in the pandemic, probably it was July that we started this off. We had to move towards MMDA because they had some certain mature way of communicating with the different with the Metro Manila mayors. And for us, it was very important that out of the medical direction that we must have, kailangan meron tayong dispatch. Merong kaagad matawagan namin na LGU na ambulance to fetch this patient and to bring that patient somewhere else. Ito yung pinaka-core talaga namin at that time when we started it. That's why we based ourselves sa MMDA. Buti na lang, in-adapt kami. But when we started off, we had just ilan lang ang aming line. We were just have a Smart and Globe and two landline which were free. But at that time, at siguro mga 100 to 150 calls, pwede pa namin makaya kasi meron kaming call center at that time na meron kaming yung sobrang calls pinapasa sa kanila.
Okay.
After
Pero
last year, nawala na yung call center na yung magre-receive ng mga sobra na calls. So ang nangyayari, you have to wait for the one hospital command to pick up your call for you to have the medical direction. So ang ginawa po namin ngayon, because we know that's the weakness, no? Actually, ang weakness talaga namin is basically the sophistication of telecommunication and making sure that the public can connect to us. And we can also connect to the different institutions. But to do that means that we have to upgrade our systems. In other words, I need to have a PABX, I need to have a call forwarding, I have to make sure that I have enough lines open for me to connect to the different institutions and for the public to connect to us. And that's what we're doing right now.
Yusek, considering all these requirements po, you do need funding for this. You do need resources for this. And we don't know how long pa to tatagal. Are you getting enough? Kasi for example, I understand you're getting 400 calls a day and that's overwhelming already. Diba? So in the end, it boils down to funding.
Right.
If you require the funding, have you been able to ask for the funding already, or has the funding been sourced? I mean, if Congress can pass a balikatan to giving the president authority to reallocate funding, here we're talking about hospitalization po of people who are sick and who are who could possibly die in the driveway. Di ba po? Yun po, as a matter of funding, as a matter of budgeting, as a matter of resources, how are we with regard to that? Meron ho bang paghuhugutan o hindi pa ho napaplano yun?
Actually, yung budget kasi yan, Ed, because this is something very new. And it was not even in the Department of Health in terms of this kind of referral systems. So when we started out, the private sector helped us out. Globe helped us out. PLDT helped us out. And then PCSO helped us out because they have a PABX system. That's where we're trying to connect with that. But in terms of the funding, the DOH actually is in the forefront of this. Kami yung lead agency dito and we have to make sure we should deliver the Department of Health. But we are also asking if there is a Bayanihan Part 3 that the increase in the number of personnel, augmentation, and the improvement of technology must be a part of the budget that comes along.
Yes, sir.
Kasi it
Yes,
is
sir.
very important.
Or at
For me
least, sir,
kasi,
yes, sir, or at least, sir, the authority to reallocate kasi that was given in Bayanihan 1. Even
Yeah,
if you
right.
don't, even if you don't give additional funding or additional, if you don't, even if you don't have a supplemental budget for 2021, at least the authority to reallocate from
right.
existing projects. And
Yeah.
you need that for
Yeah,
contact
right.
tracing, for ICU beds, for the triage system.
Right,
Di ba po,
right.
napaka-importante sa inyo.
Right.
Pero
That's
ako,
what we're
Yusek-
doing right now. Bayanihan 3.
Ako naman, Usec, just from a completely
Right.
user point of view, no? Ako yung may COVID or may kapamilyang may COVID. So tatawag ako sa inyo. Ano po ang maasahan ko? Kayo po ba ay tutulong na makapasok ako sa ospital kung yun ang kailangan ko? Or bibigyan nyo lang ako ng mga options ko? Depende sa kung saan ako nakatira, anong pinakamalapit? Or ihahatid nyo ba ang pasyente sa mismong ospital? Ano po bang service? Ako kasi dyan nga, people really want to know,
Yeah.
what does one command really do? What can it do? Yeah.
The most important, Chief, in terms of a coordinated care, is to find out and classify you on what kind of patient you are. Are you a
Okay, yeah.
mild,
So,
moderate, or severe?
yes, setting that aside.
These are the questions.
Yeah,
So if you
yeah.
are mild, there is always an option that you can stay sa bahay mo if you have a one room for yourself, a bathroom for yourself,
Yes,
and
yes.
you know that kind of stuff.
Yes, sir.
Right. Yes.
Stay in an isolated facility. That's the option they will give you.
Yes, fine. But when you're already naghihingalo,
Pag naghihingalaw pa, hahanapan ka ng intensive care unit or the nearest emergency room area. Kasi pag nasa emergency room ka, it is always a must for a doctor to prioritize you kasi this is life and death.
okay, yun nga ang tanong ko, Usec.
Gag-guide ka ngayon where the nearest emergency room would be so that you will be attended to. Yun ang medical direction. That's what we're saying. That's the medical direction
Kaya lang-
that we...
Paano nga kung puno?
Exactly.
Paano
Kasi
nga-
Usec,
Kaya
iba
ako
yung-
ang tanong ng tao.
Iba yung nearest sa yung makakapasok ka.
Pasok ka.
Diba?
Pero ganito, this is what I'm saying. Even in the emergency room, even if it's full, the doctors will always know what is life and death. What is a serious and a red patient. Uunahin talaga yan. Because if they don't do that, that's neglect.
Okay. Now,
Uunahin ka. That's prioritization of medical
Usec, ituloy ko
services.
lang yung tanong ni Lucci about the end user. No? So we're talking of end user with respect to the citizens. But what
Right.
about the hospitals themselves? Are they plugged into the system so that they too can actively give the information? For example, sabihin nila na, ay puno na po dito, pero dun po sa susunod. In other words, how do I enter the system?
Yeah.
Do I enter the system just by successfully calling into the OHCC, or as soon as mag-report ako sa ER, let's say hindi ako nakatawag sa dumiretso ako sa ER, will the ER, will the hospital enter me into the system on their own as well? And are they guided? Are they looking at the same dashboard? Kasi ang experience, I hope you understand why I'm asking, because ang nakikita natin sa social media is people are confused and go and driving hospital to hospital on their own, never
Or
getting any...
waiting in the parking lot, no? I mean, yun yung situation, sir.
Yeah, right. In terms of the data that connectivity between the hospital and the one hospital command, meron ho kami mga data managers na assign. We've talked this out to the different chief of hospitals or the medical directors of both public and private. Last year pa yon, na we will set up a data tracker wherein they will have to fill up this application to make sure that on our dashboard, on the One Hospital Command, we will be able to see on a granular level yung mga maraming hospitals dyan from the level 1, 2, and 3 kung ano yung mga vacancies nyo. And challenge talaga, always, I've been saying this to most of the hospital chiefs, that they must comply in terms of parang registering or encoding on a real-time basis what their vacancies or occupancy is. And that would be para makita namin on our side sa One Hospital Command. Oftentimes, last year, maganda yung compliance. Tapos nawala na yung COVID, nag-dry down na yung COVID by January and December, may pick up na naman ngayon, hindi na naman nakakomply in some of these hospitals. That's why sometimes we have a mismatch. Mismatch kami dun sa dashboard namin. But we keep on driving that. And I think they're better off right now in terms of making sure that they put in on real time the number of beds that are available for COVID. So yun ang that's the way the system goes.
Usec, I suppose part of the strength of a triage system is the fact that the person who makes a decision in the end has the authority to prioritize, di ba? I ask for that kasi, for example, in your earlier discussion of the triage system, at least I got the impression na parang it was more persuasive than mandatory for people to go to a hospital or to go to the One Hospital Command Center system. In the same way na parang mas persuasive than mandatory for hospitals to update their data on bed occupancies. Ayun po, is it really just persuasive in nature, or can you enforce it? Can you force hospitals to toe the line? Can you force hospitals to say no, you have to go to an isolation center, quarantine facility. You cannot stay in the hospital. Can that be done?
At saka, Doc, dagdagan ko lang yon kasi na-interview nga rin namin si Dr. Almora, no? At sinasabi nga niya na actually maraming mga ospital na marami pang beds pero for financial reasons, no? Yung
Ayaw nila tumanggap.
Ayaw tumanggap. So, yung bang mga yun, na-factor in nyo ba yun sa One Command na there are hospitals who actually turn away
because they can't afford they can't afford COVID patients, even though they have the COVID beds. Even though they have the numbers of COVID beds that they declare.
Alam mo, that's another kind of that's a factor na nakita talaga namin. And then this is the reason why since last week, we've asked PhilHealth. Kasi alam mo, ang ano talaga ng mga hospital chiefs, sabi niya, kasi we always pursue the parang ano namin, yung mandate na you have to increase your allocated beds, increase your intensive care unit. Because this is the only way that we can cope up with our health system capacity, especially before this pandemic. You must open up. Pero pag minsan sinasagot kami, especially the private ends, wala na kami pera. PhilHealth has not been giving us that much. We didn't have any reimbursement for so long. So, ginawa po namin last week. We talked to the Office of the President. We talked to Sec Vince and the National Task Force, si Sec Galvez. We asked PhilHealth, kailangan, you need to come up with a certain kind of financial reimbursement for the hospitals. So that ito para namang mag-open up sila, because in this pandemic, we know very well they are spending so much. So when it was approved that 60% of their valid claims for 1 year will have PhilHealth reimbursement, ang mga chief of hospitals, they were now very appreciative of the idea na, sige, we will come up with 2 more ICU areas. We can find out, we can buy some resources, we can hire the nurses, and we can actually allocate more beds. So in other words, ito yung factor na pag meron ding financial support coming from government and PhilHealth, actually it can work both ways in terms of making sure that the patients can have access and the hospitals will provide that kind of access to these patients. Yun yung nakita namin na dimension sa ngayon.
Okay.
Sir, Bok, pasingit lang.
Sige.
Sir, balikan ko lang yung tanong ko kanina. are you getting the resources that you need for the one hospital command center? Something as simple as PABX kanina pinag-uusapan natin para wala kayong PABX.
Ed, yes, because we have from coming from Bayan and ENT there are some allocated funds for it, and we have sources out from the Department of Health. So we are trying to improve on our telecommunication systems. We can hire more people, and I think we can move to a better place where we can accommodate more, and finally, probably the one hospital command would really come up with not just helping out the population for medical direction in this pandemic, but it will later on be a coordinated referral for all over the country.
Okay. Usec Vega, Treatment Chief and Health Undersecretary Leopoldo Vega. Maraming salamat po.
Salamat
gabi po.
Thank you po.
Ingat po.
Salamat po.
And we need to take a break. Please stay with us. The Chiefs will be right back. Welcome back to the Chiefs here on One News. We continue our conversation. Now joining us is Professor Renato de Castro of the International Studies Department of the DLSU University. Good evening, Professor de Castro.
I'm sorry, cannot hear you. Can you make it louder?
Yes, can you hear me, sir?
Now, yeah.
Okay,
Yes.
welcome, Professor de Castro.
Good
Yes,
evening,
Ah,
Good evening,
Good evening po.
Good evening, Prof.
Sir, raming developments ngayon. No? We deployed Navy ships to Julian Felipe, two diplomatic protests filed by the Department of Foreign Affairs. I wanted to start with something that we learned yesterday because we were speaking with Vice Admiral Ramil Enriquez of the Philippine Navy Western Command yesterday. And sinabi niya, yung most of the 200 ships that were in Julian Felipe, wala na. As of yesterday, it was like 9, possibly 6. Pero yung mga nag-alisan daw, na-dispersed lang, still within our EEZ, but na-dispersed, umalis ng Julian Felipe, pero na-dispersed lang. Is that progress?
Nasa easy pa
No,
rin yan.
is that progress? How would you assess that?
On the one hand, at least they are taking note of what we have been doing, and of course how our allies are also reacting. China is very much aware that there's two battle groups, U.S. Navy battle groups in the South China Sea. No, and of course you have this comments from the Australian ambassador, from Japan. So China is taking note of this, but this is a case that one step forward, 2 steps backward. No, hindi yan iiwan ng China. We have to watch out.
Okay.
This might be a tactical victory on our part, but for how long?
Okay.
We're dealing with a very determined, resourceful, and also wealthy opponent.
Okay. Outside of diplomatic protests that we're filing and that Secretary Locsin intends to file every day until the last ship now is out of the EEZ. Apart from that, what can we really do? What can we strengthen also regionally and as well as far as our relations with the U.S., for example, given the new administration there?
I think the starting point, pinag-uusapan namin dito, it starts here. If our government is really determined to challenge China. No, but if you have different voices coming out in government, then we have a problem.
Can you be more specific? Because
Well, one thing is clear.
Secretary Locsin
Yeah,
is
Secretary
saying na,
Locsin.
And
I
the
have no
fact
problem
that
with
we have
Secretary
someone-
Locsin.
Yes, the ambassador. Okay.
Secretary Lorenzana, I think they know their job. They know, that what's the score, what's what's on the table.
So who's
When
your
you-
problem?
When you have statements that this could be resolved among friends, is China a friend? Will you consider a country that's bent on depriving you 85% of your exclusive economic zone, have applied gray zone operations against you since 1996? Remember Mischief Reef, Scarborough Shoal, right? Then, of course, bent on ignoring international law. Will you consider that country as a friend?
Well, sir, they are using gray zone operations now, so you might consider them as frenemies. Parang somewhere in between. No, I bring that up kasi for example, di ba? Today the military announced it's sending 3 naval vessels, military vessels natin, to the area to beef up yung 2 vessels already there. I'm wondering how that factors in everything. Considering na, for example, you had Hubei class missile boats that were shadowing Chara Zambrano's ship just last week. For example, what if the 2 of them meet along within our EEZ, yung missile boat ng China at yung ating Navy ships? What could or would happen, or what would be the protocol, considering it's our EEZ?
I just want to ask though, is it confirmed it's a Navy ship? It's gray, it's not Coast Guard?
Which one, sir? Yung papadala natin?
Papadala natin. Kasi,
Announced
yes, sir. Navy.
Subihana, sir. 3 naval ships daw.
well, that will be, of course, China would probably send 9. China will use swarming, like what happened in Scarborough Shoal.
So hindi pa swarming tong lagay na to.
Hindi pa, let's expect they would react. The Chinese approach will be tit for tat. So China would probably announce they'll be sending 5 or 6 of their gray ships. Or probably, this is my guess, no? They'll be probably sending their huge Coast Guard vessels.
Those are white ships.
White ships. That will put us really again on the spot.
Yeah. Yes.
But
Kasi wala tayo masyadong.
Wala. Tapos papadala nila ulit yung mga more
Okay.
militias.
So, yeah, okay. So, and then, I mean, so
Warming.
is this just stepping up all the time? And tayo naman, hanggang 3 naval ships lang siguro tayo, no? Wala na tayong magagawa beyond that.
Yun na
Yeah,
tayo.
of course.
Meron pa ba?
Dito siguro papasok ngayon yung allies. I remember what happened last year when the Chinese sent their Coast Guard vessel to shadow a Malaysian survey ship that was conducting oil exploration in the Malaysian exclusive economic zone. So you have this 2 standoff, nagpadalang Vietnam. So it became a 3-sided standoff. Tapos eventually the United States entered the picture, then even Australia. So at this point, the Chinese decided to back off.
okay. So we're following the same pattern.
So
Because
this might not be circa 2012. When at that time, of course, we have the administration at the time really was determined to engage China in a head-on standoff until, of course, it was persuaded by the third party, the U.S., to withdraw it. But of course, China reneged. So this is a different situation now.
but it does
Because remember, you have two U.S. naval battle groups in the South China Sea. One amphibious, one carrier battle group. So let's see. But once you have the standoff between the great powers, we will just be spectators.
but it is an escalation already. I mean, regardless
I think
of
we're seeing.
It's an
we're
escalation.
seeing.
It will lead to, in fact, de facto already an internationalization of the tensions there. Does the timing of all of this and these moves have anything to do with the timing as well of Balikatan?
No, the timing here is the Biden administration.
Okay.
Probably this is an effort of China to to test the Biden administration, along with what's happening in Taiwan.
And therefore,
So
what
this is,
are, and therefore, that begs the question, what are you seeing on the side of Washington? Because the rhetoric and the words from Washington are, you have to admit, much stronger and clearer now, not only with respect to Donald Trump, but even with respect to Obama's supposed pivot to Asia that didn't really translate to anything.
Yes, the recent assurance of Secretary Biden. No, remember, even Secretary Blinken, I'm sorry,
President.
President of the
Blinken.
Mexico.
Okay.
Okay, I'm sorry. This is my fourth webinar today. Since 7:30, that's this morning. So please, Secretary Anthony Blinken. Usually, they would just state what is written in the Mutual Defense Treaty.
Okay.
Any attack on Philippine public vessel, sea and air. That's what's written in the MDT 1951. Now, in his recent statement, he added Armed Forces of the Philippines.
Okay.
This is an expansion of the coverage of the Mutual Defense Treaty.
Okay.
And any Philippine public, even probably Coast Guard.
Okay. Professor De Castro, I just want to bring in, joining us also in our conversation, is Professor Victor
Yes, my
Manhit,
colleague.
President of the
Colleague.
Albert de Rosario Institute for Strategic
My boss
and
in the
International
Albert de
Studies.
Rosario Institute.
Good evening, Professor Dindo Manhit.
Hi.
Good evening,
to everyone.
Dindo.
Hindi ako
Hi, sir.
hindi ako nasanay doon sa given names mo Professor Dindo. Okay, but you've been listening in on the conversation. I'd invite you to just jump in. Do you have other insights and your take on what's happening?
Yeah, of course, I defer to Rene. I'll just add some points. I think is it Ed who raised earlier the Lucci was what can be done. No? I think the whole idea where we are right now is that number one, as this becomes more internationalized, I think really the challenge to government beyond raising it through diplomatic protests, it's very bilateral. You keep on engaging China. And if you are playing with a bigger nation, why do it bilaterally? So bring it parang multilateral. That's why some views there are file it in the United Nations, make it a discussion, make it an more international issue. Professor Rene or Dr. Rene raised the issue of alliances. And something that I'd like to add to what Dr. Rene mentioned earlier is the reality that what makes it different from Scarborough Shoal, that's why you would see some of our allies, friends, strategic partners to be more aggressively maybe supportive of us is that of the 2016 arbitral ruling. Before the 2016 ruling, China and the rest of the world could say, oh, this is disputed. But after that ruling, hindi na siya disputed. We might not be in possession. So that's why since then, I've always seen how our friends from US, from other countries, Australia, Japan, maybe even South Korea, or even India, given the Quad, seems to view things differently. And just to add also, I think what we need to do, we just have 3 ships maybe, but something that a lot of people don't realize, then Deputy Secretary Anthony Blinken was an architect of an idea that should have been implemented in 2016 before Obama stepped down. It's called the Joint Patrol with the Philippine Navy. That means our own Navy don't patrol the seas on their own. Because, of course, we always say they're small. But if they will patrol with a bigger Navy. And I remember...
How do you think China will react to that? I'm just curious, no? Because Professor De Castro said that for our 3 Navy vessels, they will probably send in 9. And so if we patrol alongside U.S. Navy vessels, how do you think China will react?
Then they will not send more because it will escalate. And it will be a test for them.
Dindo, linawin ko lang, linawin ko lang yan. So,
strategically.
linawin ko lang, ang framing ng joint patrol is the Philippines basically saying, easy namin to. We're inviting our friends to help us patrol our waters. It's really that simple.
Yes, it's as simple as that. Kaya ako I wanted to raise that para to simplify things. No, it's about our EEZ. We have rights given to us by international law, and our friends, maybe not only the U.S. but joint patrol with other allies, or those with like Australia, maybe for example, or Japan, as they help us with Coast Guard. So a lot of possibilities. No? That we have failed to harness since 2016.
Prof, I suppose there are two extremes that you want to avoid. One extreme is yung militarizing further or escalating the situation beyond what you would want. And on the other extreme naman is yung we have a standoff and then we end up placating each other and then we go back to how it was. Na China again pushing us around and all that. I suppose you want to avoid that.
That's a difference. No, that's a difference since 2012. That's why we filed the case. When we filed and won the case, it gave us legal or legitimacy. That's why it's easier for us to harness our allies. That's why I understand also where the weakness of the Obama position at that time also. He cannot side. That's why it's very clear. Oh, it's very clear. The first thing the Biden administration spoke of, before this, is that we accept the victory of the Philippines. Those simple lines speaks more. But there's a difference now.
Do you get the sense that we're actually getting more and more countries to explicitly side with us on this? Because today, si retired Justice Carpio came out with a statement saying that the UNCLOS will collapse, not just may collapse, but will collapse if China succeeds in taking over the rest of the West Philippine Sea. And so he was saying that other countries must unite. Are they in fact uniting on this? Or is it just us making noise along with our traditional partner?
Something that you have to take note of. How come the United Kingdom is interested in sending aircraft carriers? How come France? What's the interest of these countries? Except that they are with us in terms of international law.
Yeah, Professor.
How come Germany would like to do military exercise with countries like, I think, is it Japan, Rene, or India? So there are groups, and they all are bounded by the idea that we have this shared value of respecting the rule-based international system. I think that's what Justice Carpio was really raising, that if you allow it, then there's no use for any international law.
Professor,
so countries should unite.
Professor De Castro, I want to pick up on that because if
I
we're hearing
agree
it correctly,
with Dindo,
if I may, I just want to put in one more question to that. If the arbitral ruling gave the international community the legal footing that they want to be more assertive and more confident to enter the arena, what about the other footing in the Philippines? Are we getting enough of a clear and stable enough policy messaging from Malacanang na ito, pwede nyo ring tungtungan to. Ito na rin ang position namin from now on. Is that clear and stable enough at this point?
Okay. Let's go first in what happened when the ruling came out. Now, after, of course, our president visited Beijing, it was announced
after the ruling.
When he went to Beijing in October.
October.
When he was given $24 billion promise by Xi Jinping. He said, I will set the ruling aside. And it was consistent. The first country that actually used the ruling the following year was Malaysia. When Malaysia declared its continental shelf, Malaysia said we don't have any dispute with China because the 9-dash line has been considered as beyond international law, so they used the ruling. Followed by Indonesia. When Indonesia declared its exclusive economic zone north of the Natuna Island. The 9-dash line has been considered illegitimate under international law, so we are declaring. So this is the irony about it. Other countries had been using the ruling not because they're law-abiding, but simply because it serves their interests. The U.S., of course, conducts freedom of navigation operation. The irony here is the United States, is not even a member of UNCLOS. But it's in the interest of the United States Navy to have access to the open seas, to minimize the nature of what they call expansive claims by coastal states. So this is where you have the convergence. No, we acknowledged the ruling only last year. And it was, of course, Secretary Locsin on the day itself. It was Sunday. Sunday, 4 a.m. in the morning, Secretary Locsin came out with this announcement. Then the following day, Monday, it was, of course, Secretary Pompeo. And, of course, in the United Nations General Assembly, you have a number of countries submitting their diplomatic communications, basically reaffirming the 2016 ruling. So even Brunei. So it is not anymore quoting the head of the international department or the foreign policy department of the Communist Party, Yang Jiechi. It's not anymore a scrap of paper.
Okay.
It's more than a scrap of paper.
Oh, yeah, but wala nang atrasan doon, even if, I mean, both on the level of wala na bang atrasan dito ang, let's say, the President Duterte, or for that matter, in the context of kahit umatras or kahit manlamya ulit, the international footing is already there, and the international community feels confident enough to move on their own, even without Malacanang.
That's a problem. I'll just add something to Rene. It's a problem is we see strong statements from Secretary Lorenzana, Secretary Locsin. But at the end of the day, who is the chief architect? Is that the word, Rene? Chief architect. That's the president. Who is the commander-in-chief of the armed forces? It's our president. He seems to be quiet on these things.
Hindi naman siya umaatras eh. Nawawala lang. Right?
May proof of life.
What's the worst that can happen?
Well, it should be there.
Is that the worst that can happen?
Yeah, it should be there to basically announce.
So you're not yet seeing a repivot on the part of Malacanang, but can you say that, the government is actually repivoting, except that Malacanang is not being explicit about it? Can we read it this way?
I don't see it that way. I see the leadership of Secretary Lorenzana. Maybe it was an independent stand on his part, and suddenly maybe Malacanang is hiding behind it, but still you would like your own government. But it's getting a life of its own, when you see different business groups coming out with a strong statement at the height of this pandemic, at the height of economic hardship, when you see academics, and when you see the you should have, as media, you should have taken notice that, the first thing, an Australian ambassador and a Japanese ambassador having a strong stance on it early on. These are unheard of. So we have to see value in that. Instead of just looking always at the past, we have to see where we are now and see that there are things. I always like to remind people that, when President Duterte was pivoting to China, hosting everybody in the ASEAN summit in 2017, a year after he pivoted to China, 4 countries met in the Philippines without them knowing it. And they said that they will form, or they will resuscitate or renew yung commitment in the Quad. That means 4 countries in India, Japan, the US, and Australia to protect the rule of law as they share values on this. And core to their argument again, part of their argument is our victory. So can you imagine that? So parang why do we hit ourselves? Parang tayo nagtuturuan, walang nangyayari, pero may nangyayari. Ang problema, ayaw i-report yung nangyayari sa atin or ayaw palaki ng ating gobyerno kasi mapapahiya sila.
Baka naman they're playing good cop, bad cop. Kaya, sige, Lorenzana, ikaw na yung bad cop, ako yung good cop.
Ako, ibang basa ko eh. Baka hindi nila na-expect yung stance ni Secretary Lorenzana because, at the end of the day, the accountability of Secretary Lorenzana is defense. Maybe when he saw it, if I track the news, I think he was just reacting to the report of the task force. And maybe, but he did not expect China to treat him that way, very aggressively put him down. And that's arrogance. So maybe on the part of Secretary Lorenzana, he simply reacted back without realizing that there is social support for that. That means a broad society of Philippines. Kasi sa akin ba nga, may doubt pa ako kay Secretary Lorenzana. I think he was tempting Secretary Lorenzana. I will file a protest if I'm instructed.
Yeah,
yeah,
but Dindo, yun din yung tanong ko eh. So
Secretary, that the President will reverse what's happening now? What are the chances that the President will reverse what's happening now? Is that a likelihood?
I'll wear my hat as a political consultant, not as a strategic. That will be bad politics.
Okay.
And he will lose support of the Filipino people.
But Dindo, I wanted to follow up. I mean, I know we're running out of time, but quickly lang. So you're saying your gut feeling is that even Secretary Locsin is just following the lead of Secretary Lorenzana, and you can see these moves not just in the DND but also the DFA without ascribing this all the way to Malacanang?
I think Secretary Locsin was forced in a situation because it was simply, I'm just following, as I've said, the steps that took place. No, I look at it and analyze from that perspective. And from there, we have seen the DFA. It was also Lorenzana who argued against the diplomatic. Can you imagine a diplomat, not even an ambassador, treating a member of the cabinet that way?
Okay.
That's unheard of. You have not seen that in the history of the Philippine Republic since 1946.
Okay. O, sige.
But did we all react? No.
Okay.
We allowed it in our own country.
Okay. Clearly, no doubt, we will be monitoring and revisiting this some more in the coming days. For now, we've run out of time. Thank you for joining us, Professors Dindo Manhit and Dr. Renato de Castro.
Thank you.
Thank you.
Salamat. Good evening.
Good night.
Good evening. Stay safe.
Thank you, sir.
Bye-bye.
Bye.
And that will be all for this special edition of The Chiefs. We hope what was discussed here will keep the conversation going. Before we go, a reminder to everyone, mask on, wash hands, stay safe, Philippines. Ako po si Robbie Alampay.
I'm Lucy Cruz Valdez of News 5.
I'm Ed Lingao. We are One News.